Thank you. Thank you. Well, John, I'm thrilled that Rotary's stepping up once again with that huge commitment to raise $50 million a year. Now that the end is in sight, we want to support you totally and work together to close this funding gap. So your goal of $50 million a year over the next 3 years, that'll bring $150 million. And I want to help with that, so our foundation will extend our 2-for-1 match to that full $50 million. And so Rotary will be able to raise Thank you. So in total, if you meet your $50 million, we'll do the match over the 3 years, $450 million. That's going to get it done.
That's what we get.
All right. Thank you.
Thank you.
Well, I'm very excited to be here. And Rotary has been just an unbelievable partner in the work we do together on polio. That $450 million I just mentioned will bring the total that our two organizations have brought to bear since 2007 to over $1.5 billion. But I think you all know that money, although very critical and something that our foundation and Rotary have taken the lead on, that's only one piece of the story of Rotary's leadership on polio eradication. In fact, your involvement started over 30 years ago, and since then, in the face of challenges that no one would have predicted, you've kept it on the global agenda. Whether it's Washington, D.C., European capitals, everywhere in the world, Rotarians have insisted that the fight against polio gets the funding it needs. And in high-risk countries, Rotarians have made sure that government leaders at all levels are doing their best. But perhaps most importantly, Rotarians have volunteered. A great example is Ann Lee Hussey, who was diagnosed with polio as a toddler. She led volunteers on over 25 trips to some of the most dangerous places on Earth. Dr. Yoshi Sakiba, a Japanese pediatrician, just led a team of 60 Rotarians to Delhi for the 16th consecutive year. And thousands of Rotarians in at-risk and endemic countries have spent countless hours immunizing kids. Rotary has also done something no other organization could do. It's mobilized members to build bridges when we needed them most. I'm thinking of people like Mary Irene Richmond Oua, who lives in Ivory Coast. When there was a coup in her country years ago, the new military ruler canceled a national immunization day. She appealed, saying children should not suffer because of a conflict created by adults. And days later, the general presided over the opening of the rescheduled immunization day. In Pakistan, Rotarians have helped overcome mistrust by working with Islamic scholars and other religious leaders who are now advocates for the polio program. And Rotary has funded dozens of community centers and immunization posts in high-risk areas. For example, a Rotary-funded health center run by Tayyaba Gul, a member of the Rotary Club of Islamabad, is working with displaced people to help them understand that polio immunization is a normal part of postnatal care. These efforts have helped reduce polio in Pakistan from 306 cases in 2014 to just 2 cases so far this year. That's the kind of approach that's needed to finish the job. But it's important that we not lose sight of the massive effort that's brought us to this point. The Global Polio Eradication Initiative is the single most ambitious health effort the world has ever undertaken. We've gone from 125 endemic countries in 1988 to just 3 countries today. And from 40 countries an hour 30 years ago to less than 40 cases in all of 2016. It's easy to forget how terrible a disease polio was and how far we've come. So let's take a moment to reflect on that progress. Not long ago, polio was everywhere. In 1994, the Americas were certified as polio-free. In 2000, the Western Pacific region was certified as polio-free. In 2002, Europe was certified as polio-free. In 2014, Southeast Asia, including India, was certified as polio-free. So this year, we're down to just a handful of cases in 3 countries: Pakistan, Nigeria, and Afghanistan. So I see a lot of green lights out there. The scale of this effort really is phenomenal. Since the year 2000, more than 10 billion doses of oral polio vaccine have been administered by an army of 20 million volunteers and a global team of thousands of frontline health workers. But in my opinion, the statistic that captures the impact the best is this one. More than 16 million people are walking today who would otherwise have been paralyzed by polio. Yet, we all have one big question on our minds. It's something I think about all the time. Why has it taken so long? The original plan was to be done with polio by 2000, before our foundation was involved. And polio has been my top priority for a decade now. And I think we'd all agree this has been harder than any of us expected. The answer has to do with the ambition of the polio eradication program. Eradication means 0 cases, all 7.5 billion people on the planet, across all 200 million square miles, no polio. That includes places where there is war. It includes countries where public health systems are virtually non-existent. It means reaching children in the most difficult places on earth, not just once, but many times to ensure they're protected. What worked in over 100 countries where elimination was achieved years ago wasn't enough in the last handful of countries. But that's what's so impressive about the polio program. Through persistence and innovation, it has risen to the challenge again and again. It's the talent for generating new ideas, building on lessons learned, and adapting to new circumstances that make me optimistic we will get to 0. Let me share a few examples of what I mean. One of the toughest things to do is to reach all the children who need the polio vaccine. This is especially hard in conflict areas because it's so difficult to build trust with all sides. Yet in Afghanistan, despite the enormous security challenges, most of the country remains polio-free. Why? Because the people running the program have helped build understanding that the only way to get rid of polio is to rise above political, religious, and social divisions. Working in areas of instability is extraordinarily challenging, and frontline health workers have risked, and in some cases sacrificed, their lives. And as quickly as progress is made, it can disappear. The detection of polio in Nigeria last year, after a gap of 2 years, was a reminder of how hard it is to eliminate the disease in conflict areas. Fortunately, the Nigerian government has responded. Another challenge is that some parents refuse to have their children immunized because of fear or misunderstanding. In Nigeria and Afghanistan, as in Pakistan, efforts to engage traditional and religious leaders have made a big difference. Today, the overwhelming percentage of parents in these communities want their kids to be vaccinated. One of the people who helped with this is His Highness, the Emir of Kano, one of northern Nigeria's most prominent traditional leaders. He once ventured into an area known for its resistance to polio vaccination and consumed an entire vial of vaccine to reassure people that it was safe. The hiring of thousands of female health workers and social mobilizers also has helped build trust with families in traditional societies where men cannot enter other people's homes or interact with mothers. 5 days a week, Fiaz Bibi, a vaccinator in the Punjab province of Pakistan, covers herself with a burqa, walks 3 miles to a dispensary to pick up supplies, and then makes her rounds among the 105 families in her community. Temperatures can exceed 110 degrees, and Fiaz often feels the disapproving eyes of villagers following her. Yet she persists, visiting every nook and cranny of her village because she believes it is her moral duty to make sure every child is protected against polio. Another challenge in getting to zero is knowing where the children are who need to be vaccinated. In the last few years, the polio campaign has made great progress on this, thanks in part to something we take for granted in wealthy countries: detailed maps. On the left is an example of a map that vaccinators in northern Nigeria used until a few years ago. They were hand-drawn, inaccurate, and incomplete. It's estimated that thousands of small hamlets were never included in the vaccination program because, simply put, they weren't on the map. And you can't beat polio that way. Today, the map looks like the one on the right. They identify all the villages, and with more accurate information about the location and size of these communities, the map helps supervisors manage their teams efficiently. Another big challenge is finding the last vestiges of the virus. With fewer and fewer cases of polio, this work is both more difficult and more important. To stop the virus, we need to know where it is hiding. There are 2 ways we do this. The first, of course, is finding the paralyzed children and testing their stool to see if it was caused by polio. This is a massive undertaking supported by a network of 146 laboratories around the world. They test 200,000 samples every year, and 99.9% of the time, the results come back negative. But the tiny fraction of positive results tells us where to focus to stop polio from spreading. The other way, and this is new, is to look in the sewage system in the high-risk areas. This can identify that there's polio in the environment before it paralyzes a single child. In Nigeria, Afghanistan, and Pakistan alone, we have more than 125 environmental detection sites operating. And worldwide, over 70 countries do this surveillance to make sure that if the virus crosses borders, it will be found quickly and stopped. So these are the types of innovations that will get us to the goal of eradication. Every example I give also will be helpful with other global health efforts. Better maps will help health workers reach children with other life-saving vaccines and medicines. The surveillance networks will help detect and prevent the spread of other infectious diseases like Ebola, measles, and yellow fever. And a huge cadre of trained health workers armed with vital data now have the expertise to provide critical health services to the most vulnerable people. The recent Ebola outbreak in West Africa is a case in point. Tragically, that outbreak killed more than 11,000 people, mainly in 3 countries: Guinea, Liberia, and Sierra Leone. But the death toll would have been much greater if quick action by polio workers had not stopped the disease from spreading into neighboring Nigeria. As soon as they saw a few cases showed up in Lagos, Nigeria's biggest city, the polio workers jumped into action. They set up an emergency operations center to coordinate efforts. They tracked hundreds of people who'd come in contact with Ebola patients. And they developed community volunteers to get the message out on how to stay safe. Their efforts prevented what could have been an even greater tragedy if Ebola cases had been allowed to multiply over in Nigeria, an international travel hub with a population 8 times the size of the 3 affected countries. This is what is so exciting about Rotary's 30-year fight. Not only are you eradicating one of the worst diseases in history, you are also helping the poorest countries provide their citizens with better health and a better future. And getting to zero is incredibly inspiring as an achievement of humanity. Some people, especially these days, only see the bad things in the world. They see it getting worse. But the progress on polio is a great reminder to people that we can accomplish great things when we're bold, determined, and willing to work together. Earlier this morning, we had a get-together of representatives from the donor countries pledged to support this final push on polio. It was fantastic to see Canada, Japan, Germany, Australia, the European Commission, and His Highness Sheikh Mohammed bin Zayed from the United Arab Emirates all stepping up with new pledges. I also want to acknowledge the United States, which has been the largest government funder of global polio eradication. The support of these countries and others is an example of why foreign aid is so important. Without it, we wouldn't have come as far as we have on polio. And we wouldn't have made such great progress reducing childhood deaths from other preventable diseases like pneumonia, diarrhea, and malaria. This is my favorite chart. It shows that in the last 25 years, the world has cut childhood deaths in half. If you add it all up, from 1990 to 2015, that's 122 million lives saved. We can cut the death rate in half again by 2030 if governments continue to invest in vaccines, maternal and newborn health, and HIV prevention and treatment. And that is what will let us break the cycle of disease and poverty in low-income countries, and that's what will enable all countries to prosper. Now, some countries, including our own, are talking about cuts to foreign aid. These investments amount to less than 1% of the US budget, so eliminating them wouldn't make a huge dent. But continuing these programs will make a big difference in the lives of millions of children and families around the world. Helping other countries fight poverty and disease also makes the world more stable, and it makes Americans and people everywhere safer. This aid delivers a fantastic return on investment. You know this because you've been following the success of the polio campaign for years. When the story of polio eradication is written, it will be about millions of individuals linking arms and persevering in the face of innumerable setbacks. Rotary laid the foundation with its unwavering sense of purpose and its belief that anything is possible if you put your mind and body to it. But we aren't quite ready to write the final chapter of that story yet. To be certain that polio is eliminated, we have to maintain vaccination rates at a very high level. And even when we get to zero, we have to go 3 years without a new case. We don't have any other option, because if we fail, polio will return to the countries where it's been eliminated, and it will once again kill and paralyze hundreds of thousands of children a year. So I want to thank you for your continued engagement. The resources you provide make an incredible difference. The volunteer work that ensure that vaccines get to the children is phenomenal. And the most important advocates for polio eradication is Rotary. No one can do a better job of reminding leaders that this work is important and not yet finished. Through the kind of commitment and generosity you show, the world is getting better for humanity. People are living longer lives, healthier lives. Extreme poverty is down below 10%. We did eradicate smallpox. These are incredible achievements. And when we add the end of polio to the list, which I'm certain we will, it will be another triumph for humankind. It will be a testament to the compassion, generosity, and kindness of more than 1 million Rotarians around the world. You are the people who are making it possible to get to zero, and that will be something worth celebrating. Thank you.